Chapter 13, Children with Physical Disabilities and Health Impairments. A child is considered to have a physical disability if his or her condition impacts their skeletal, muscular, or neurological systems. When it comes to neurological impairments, many are familiar with cerebral palsy. And what cerebral palsy is basically miscommunication between the child's brain and his or her muscles. And as a result, there are different levels of cerebral palsy, and it impacts their ability to sometimes walk, do basic tasks that may include eating, bathing, taking care of their other needs, as well as in gripping a pencil. There are also other neurological impairments like seizure disorders. The most common one that people hear about is epilepsy. And seizure disorders are characterized as unorganized bursts of electrical impulses from the brain. And as a result, the body reacts and scrambles because of the miscommunication and causes the body to act out in ways that are considered abnormal. When it comes to epilepsy, this condition is definitely neurologically based, and the primary characteristic of it is different types of seizures. The two main types are the grand mal seizure, which involves the whole body and can last for an extended period of time, and then sometimes children will have petit mal seizures, and sometimes these are called absence seizures, where the child will seem to kind of space out for 15 to 30 seconds. Sometimes it may seem like they're just staring off and daydreaming. And in some cases, it's very natural for children to daydream, and they may be daydreaming. But when they're having an absence seizure, you are unable to connect with them and kind of bring them back around because their brain is experiencing an electrical outburst. There are different types of musculoskeletal conditions. They include muscular dystrophy, juvenile rheumatoid arthritis, and congenital malformations. And so these are different types of conditions that a child is born with. Then there's traumatic injuries. There can be a traumatic injury to the spinal cord that can sometimes result in paralysis. And then there's TBIs, which I feel like everyone is familiar with because it's been in the news, at least it was a few years ago, behind concussions and the increase of concussions and a disorder that was CTE that was developed around the impact it was having on football players. And they were going back and looking at people who engaged in high impact sports that involved the head, like soccer and boxing. When it comes to TBI, it's important to understand that the results of it can impact every aspect of the child's development on a social level, their educational level, their physical level, their ability to return back to their baseline is very important. So when you're looking at, when you're working with a child who has been diagnosed with a TBI, understand that these things that are mentioned here, the cognition, language, memory, so on and so forth, can all possibly be impacted. Now, there is a possibility it may not impact all of it, or it may impact some, but it's one of the things to understand that the brain is one of the most complex systems that we have, complex organs that we have in our body. And doctors will even say they don't truly fully understand everything it can do, but we do know it is capable of repairing itself. And like I said, when a person has experienced a TBI, which is basically an external physical blunt force to the brain, these are the different ways it can be impacted. And then the restoration of it is truly based on not only therapy, but also the severity of the trauma, as well as the medication. I mean, it's just everything. And then it's also, you have to think about the development of the person who has experienced it and how willing they are to work hard at getting back to where their baseline is. So when it comes to working with students with TBI, it's important to understand that in some cases, the child that left and then now the child that's coming back may be two different children. So it is important for you to also be very patient with them so that you can understand how they're feeling and how, where they are now and where you want to get them to. But it's also understanding that they're going to get more tired easily, They're going to get tired more easily. There it is. And so giving their time, giving them brain breaks is very, very helpful. The students that I work with up at the university, mostly the athletes usually come in with different types of concussions, and they talk about how they have to give their brain a break because they just can't take in so much information, not only within the class, but just having maybe multiple classes throughout the day. It's like trying to remember what happened in science, what happened in math class, what did the coach say about this. And even if they aren't necessarily practicing, sometimes athletes are able to at least attend practice. So it's just the input of the information can make the brain very, very tired. So it's going to take them longer to acquire the information, and also longer to get caught up. So it's really important when working with children with TBIs to be patient with them as much as possible. Lastly, there are other types of health impairments that you may um, encounter from children in early childhood. This could be asthma, it could be juvenile diabetes, cystic fibrosis, so on and so forth. And so in the last few weeks, we have discussed a variety of disabilities and how it impacts education, interventions, so on and so forth. So when it comes to the health impairments, this is when you lean into the other areas and you're like, well, asthma, they may have trouble with breathing. We've had fires recently, and of course there's fires still going on. Plus you still have pollen in the air, and it's just some of the things that just come with the environment. So as a teacher, you have to take these things into consideration if you have a child with asthma or asthma related conditions. It's like, should we be doing an activity outside right now? Maybe we can do something inside. Or if it's really, really hot outside and there's not a lot of wind blowing, maybe it might be a good idea to possibly do something indoors. So as the teacher, as the child care provider, these are just things that you need to take into consideration when you have a child in your classroom with a physical disability and or a health impairment.